Good morning, Dr. Bradley and fellow classmates. Matmon Harrell here again to provide my perspective of the counselor session examples that were provided for us this week here in week 4. I thought that the information was very interesting, and I actually watched them a few times just because I was so interested in them. Going into the videos, I come from a background sort of familiar with the counseling environment as a pharmacist. Many times I've had to provide some level of counseling. I guess my work would be more or less fall into the realm of motivational interviewing, trying to get the patient to change behavior, for example, smoking or taking their medication every day, and just really getting to the root of what's inhibiting them for change. So I was somewhat familiar with the counseling environment, but from the videos, my perspective here is this. On video 1, where it talked about the brainstorming video, I thought this video was probably more the textbook example of what a counseling session would be. I enjoyed how the counselor, on numerous occasions, checked his understanding of what the root cause of the client's visit, why they were there. I thought the client had a very engaging posture. However, I did think that the environment was stale, and this is my perspective from each of the videos because they were all in the same office. But I thought the environment was a little stale. The white walls, just a plain office, and I had a question which I'll ask here about what studies or what information do the experts say about the counseling environment, the smells, the sounds, the look, the appearance? Because you know when patients typically come even into a doctor's office, there's a such thing as white coat syndrome, where they get nervous and their blood pressure is elevated because of the just being in the environment, and being there with their physician. It makes them nervous. So I wonder if that effect on in the counseling world is there. In the second video for Homesick, I thought this counselor was more, she did more data collection compared to video 1. However, the counselor in the second video didn't use very many sentence stems, and I thought that her approach was a little bit too diagnostic. I think that with every statement, even before the client could finish her thought, the counselor would interject and provide some type of diagnostic of what she thought and felt the client was feeling, and this could be her approach to establishing her understanding of what the client needs. But I thought it was a little distracting, and in fact, I thought that this counselor spoke more than the actual client. For the dancing or helping, I thought that the counselor's posture supported his physical appearance. Or his physical presence, because this counselor was a little bit larger. I thought that the fact that he was still engaged, but he took a step back a little bit just to kind of, in my opinion, not feel so imposing to the client, who was comparatively a smaller female. I think that each counselor allowed the client to guide the session, and none of the counselors gave advice. So overall, I really enjoyed watching the videos. But the question again is, how does the environment affect the counseling session? I look forward to looking and reviewing more of you all's videos.